soon. These are regular briefings given twice a day, once in the morning at the Health Ministry, this one in the afternoon at the Central Disease Headquarters, which is located at the KCDC. And we'll have simultaneous interpretation.
So with regards to the coronavirus infection, I will update you on the status of infections in Korea. So as of 28th of February, and as of 9 a.m. today, compared to 24 hours ago, there has been additional 427 patients, and as of now, there are total confirmed cases of 2,022. Among these, 26 have been lifted from quarantine, and over the subjects, amounting to a total of around 44,000 people, they have been tested negative, and over 20,000 tests are undergoing. And with the addition of 427 patients, we have attached the regional status of the infections as a table. So there is the most number of cases in Daegu, and the next is followed by the Gyeongbuk province. And in the Busan region, until 9 a.m. of today, additional 63 confirmed cases have been added. And among these patients, 32 are related to the Oncheon Church. And in the Gyeongbuk province, a lot of the cases are concentrated on the group facilities. And of the investigations done so far, a lot are related to the Shincheonji Oncheon Church, and this is expected to be so. And in the Cheongdo Daenam Hospital, there has been additional cases confirmed. And until now, a total of 117 cases have been confirmed in the Daenam Hospital. And in the Chungnam province, 16 confirmed cases have been confirmed. And in the Cheonan city, we are seeing the confirmed cases concentrating on the sports facility. And also in the Gongju Medical Center, there has been one confirmed case for one of the patients who were hospitalized. So we are investigating into who has contacted this patient, and those people are actually being put under the quarantine. And we're also looking into the places that this patient has visited. And for the Central Infection Prevention Headquarters, with the spread of the coronavirus, in order to prevent the spread in the medical centers, with the concentration on these medical centers, trainings have been carried out. And the content of training is as follows. So it is for wearing the accurate protective gears and the method for doing so, and transferring patients in the exact manner, because these are really important. So such training has been carried out. And we are also providing trainings for sterilization and cleaning of the protective gears as well. And when we look at the characteristic of the epidemiology, we are looking at the selection of the protective gears, and we are also providing trainings for wearing and taking off the protective gear. So there are many things involved here. And also the task force team is working in line with the civilian dispatchers. And now I will update you on what has been researched so far. So, based on the CDC, in order to come up with the vaccines and treatments, we are also collaborating. So until now, what has been confirmed in Korea has been distributed to 52 institutions in Korea. So the research project is as follows. We are trying to look into other areas as well. For instance, quick development of the treatment and cures, and also analysis of the efficacy of the antiviruses. And also we are looking into the blood analysis. And we are also looking into development of the candidates for a vaccine. So this is a support worth around 1 billion won. And on the home pages of the CDCs, you will be able to check the content of the project.
상황과 관련해서 말씀드리겠습니다.
So I will update you on the current status.
일단 감염병 특별관리 지역의
So
발생은
first,
지난
when we
2월
look
16일경에
at
노출된
the
감염자가
infections,
잠복기를 지나서 증상이
the
발현되고
person
이들이
who has been
검사를
infected
거쳐서
around
순차적으로 확인되고
16th
있는 양상입니다.
is
해당
seeming to
지역에서는
spread the
지난
disease.
주부터
So
강화된
starting
방역 조치에 따라
last week, the
자가
prevention
격리를
measures
철저히
has been
이행하는 것이
strengthened,
추가
and
확산을
it is really
차단하기 위해서
important for
매우
people
중요하다는 말씀을
to
드립니다.
actually follow
그
the
외에도
rules for
해당
quarantine
지역
to prevent
시민들께서는
the spread.
여러 번
And
저희가
also
강조하고
for
있는
the
손
citizens
씻기,
in the
기침,
corresponding
예절
regions, we also
개인
want to
위생을
ask you
철저히 준수를
to
해주시고
follow the
개인별로
personal hygiene
식기나
rules such as
수건을
washing
각각
of hands
사용하시고
as much as possible. And we
각종
also
손길이 많이
advise you
닿는
to
물건에 대해서는
use individual
깨끗하게 닦는 등
towels
환경 위생도
and
철저히
utensils.
하는
And
것을
we also ask you to clean these
또한
products
신천지 대구
as
교회를
thoroughly as
포함한
possible.
해당
And
단체의
also
전국 모든 신도들은
for all of
여러
the
차례
followers
저희가
of the Shincheonji
별도로
Church of
당부드린
Jesus and
사항을
other religious followers, we
지켜주시기
want to ask you to follow
최대한 집에
the
머물고
rules and
외출을
comply
자제해
with them as
주시고
much as possible as we
발열이나
ask.
호흡기 증상이
So please
없더라도
refrain from
외출을
going out of the
자제해
house. And even if you're not
또 만약
coughing or
발열,
even if you
호흡기
don't
등의
have a
증상이
fever, please
나타나면
refrain from
사전에
leaving home.
1339
And when
등의
you have such
콜센터,
symptoms,
그리고
please
보건소에
make sure
문의하신
to
후에
call the call center
선별
or
진료소에서
call
검사를
the
받으시기
clinics before
바랍니다.
you get tested.
또한 평소
And
앞서
in
말씀드린
addition,
생활 수칙을 철저히
as
지켜주시고
I said before, please make sure to follow
의료인
the
방역당국의 지시를 철저히
rules
따라주시기
of
바랍니다.
personal hygiene as much as possible and also to follow the preventive measures of the medical centers. We also ask the general citizens to follow these rules, and we also ask you not to touch your face, eyes, nose, or mouth without washing your hands. And when you're visiting the medical centers, please make sure to wear your mask and please refrain from visiting areas that are crowded. And please make sure to refrain from contacting with those who have fever or who are coughing. And especially for the vulnerable populations, such as those who are over 65 years old and for people who are pregnant, please refrain from visiting crowded places. And as I said before, when you are visiting medical centers or when you are going outside of your house, please make sure to wear your mask. And also for people with high fever or people who are coughing, please refrain from going out of the house and please make sure to take a good rest and also to watch out for the progress. And if your fever becomes higher, please call the call center or the clinics and then get tested afterwards. So that was all for what was included in the press release. So we will have a Q&A session now. So we have a lot of reporters.
Okay, that was the vice head of the Central Disease Control Headquarters, Kwon Jun-ok. And he concluded there with reiterating the government's recommendations for health, protection of people's health, public health overall. But for now, that's going to conclude our live coverage of this briefing. In our upcoming newscast, though, we will have updates on all of this information, along with some in-depth analysis. And Arirang News is the place to find out the latest on the coronavirus outbreak in South Korea. As mentioned earlier, these official briefings are for now being given twice a day. So tomorrow morning, we'll bring you the next one live at 10 a.m. Korea time. That's it from the news center for now, but we'll be back at 4 p.m. Bye for now.
The novel coronaviruses are spreading all over the world. To prevent the virus from spreading further, it's essential to attend to personal hygiene and take